My name is Paul Fredland, and I had a 25-year wonderful career working as an endocrinologist. About 6 months ago, I began to note as I would have pain in my left hip. I got to the point where I had difficulty putting on my shoe or putting on my socks. And it became clear to me that the passions of my life were not going to be possible. There was a solution to my symptoms, and the solution was to consider a hip replacement. I walk into Virginia Mason. Dr. Clabeau was able to remove my degenerating femoral head, put in a shiny new titanium implant. I'm on the ward, recovering, and the physical therapists take me for my first walk. Great surgeons are necessary, but are not sufficient to get a great outcome. You need warm and empathetic nurses, and you need a team of occupational therapists and physical therapists to implement the plan. And I think the best possible living example of team medicine that I can think of is the orthopedic teams putting together a plan for hip replacement and knee replacement. Now I'm totally confident that I will regain full independence and will be able to follow all the things I love to do.